All right. So today our presentation is on rare medical diseases. And next slide. First off, let's start with defining what a rare disease is. There are several different definitions by different countries and medical organizations. For example, in the US, the Orphan Drug Act classifies a rare disease as a disease or condition that affects fewer than 200,000 people in the US, making the ratio around 1 in 1,600 people. The EU defines a rare disease as one that affects fewer than 1 in 2,000 people. These diseases, unfortunately, have very little research due to not affecting many people. Even though these diseases don't impact that many people, they're still impactful on a global and personal level. Around 80% of rare disorders and diseases are linked genetically, and 95% of them do not have any FDA-approved treatments. Understanding rare disease allows for breakthrough in treatments, as well as understanding the human genome and how mutations affect certain parts of it. So here's some examples of rare diseases. Due to it being a category of statistics and not a category of how it affects the body, there's a large variety in the types of diseases that are classified as rare. Some do fall in common categories, such as abnormal buildup of compounds in the body. There are many genetically linked blood disorders that affect clotting and hemoglobin, and there's also many neuromuscular diseases that are rare. These are only a few examples because there are over 7,000 documented rare diseases, with some estimates being up to 10,000 rare diseases. Rare diseases can also be caused by pathogens and be contagious. And next, here are some examples of rare diseases, their causes, diagnosing, and treatments. First on the list, we have histiocytic necrotizing lymphadenitis. It's better known as Kikuchi-Fujimoto disease. It's a rare disease categorized by the enlargement of lymph nodes in the neck, accompanied with mild fever and night sweats. There's a higher prevalence of this disease in Asian individuals as well as female patients. A biopsy is required to be diagnosed in case of other diseases causing these fairly common symptoms. Kikuchi-Fujimoto disease is a unique condition where the affected tissue shows signs of cell death, but the immune cells generally associated with that kind of reaction are missing. This unusual pattern makes it distinct from other diseases with similar symptoms. The treatment is usually time due to it being self-resolving in 1 to 8 months, and corticosteroids and non-steroidal anti-inflammatory drugs. The exact cause of this disease is not known. Next, we have Wilson's disease. There's more to know about this one. It's a genetic disorder that impairs the body's ability to remove copper from the body. This results in an abnormal copper buildup in the blood, possibly damaging organs. Although copper is an essential mineral for life, too much of it can cause illness. The organs most affected are the liver, eyes, and brain. Wilson disease is present at birth, but the symptoms won't show up until too much copper has been accumulated. This means that symptoms will start showing up from anywhere from the age of 5 to the age of 40. Symptoms of Wilson's disease include jaundice, abdominal pain, stiff muscles, and coordination issues. Due to how unspecific these symptoms are, diagnosing Wilson's disease can be difficult. A more specific symptom would be Kayser-Fleischer rings in the eyes, which result in a brown copper ring around the cornea. The picture below depicts the ring. It can be observed with a slit lamp. When caught early, organ damage can be mitigated and treatment can be administered. There is no cure, but treatment can be successful at keeping copper levels down. Chelating agents can remove copper from the body, and zinc can inhibit the absorption of copper into the organs. This disease is genetic and autosomal recessive. This means that both parents need to have a chromosome with the mutation and pass it down for the child in order for the child to have Wilson's disease. Next is cystic fibrosis, which is a genetic disease that affects the lungs, pancreas, and other organs. The disease is caused by a gene mutation which interferes with the movement of salt throughout cells. This results in a sticky mucus in the respiratory system as well as the digestive system. The image shows the visual difference between a healthy lung and one affected by cystic fibrosis. Cystic fibrosis is present at birth and is progressive, meaning it gets worse over time. Symptoms include salty tasting skin, persistent coughing, and wheezing. Diagnosing cystic fibrosis is a multi-step process with sweat tests to measure chloride levels, gene tests, lung function tests, and newborn screenings. Cystic fibrosis has no cure, but there are treatments. These treatments are usually personalized based on severity, symptoms, and personal goals of the patient. One of the ways to mitigate the symptom is by clearing the airway. This can be done by vibrating vests that loosen the mucus in the chest and techniques about coughing safely. There are also medications and supplements such as multivitamins, antibiotics, and pancreatic enzymes. Cystic fibrosis is genetic and autosomal recessive, meaning that both parents must have and carry down a chromosome with that specific mutation for the child to have cystic fibrosis. Next, we have AVMs, which is a tangle of blood vessels that irregularly connects veins and arteries, leading to tissues not getting enough oxygen. The walls of these vessels are also weakened, possibly causing bleeding. These can occur anywhere, but brain AVMs are especially dangerous due to the chance of hemorrhage. Symptoms vary based on location, and most aren't present before the AVM starts to bleed. A bleeding AVM can cause seizures, vision problems, lack of coordination, and weak muscle. There are subtypes of AVMs, such as the vein of Galen effect, which affects the brains of children. There are many tests that can diagnose AVMs, such as CT scans, MRIs, and MRAs. Treatment for AVM depends on where it's found and symptoms. Surgery may be needed if there is risk of bleeding and further damage. This disease is not shown to be hereditary, and its risk factors are not known. Next, we have hemolytic uremic syndrome, HUS, which is a condition where small blood vessels become inflamed and damaged, possibly causing clots, anemia, and damaged organs, kidneys especially. Symptoms can stem from the anemia, which can cause easy bruising and pale skin, or can stem from kidney damage, such as vomiting, confusion, or swelling. HUS is diagnosed through blood tests and urine tests to measure if anemia or kidney damage is present. Treatment is based off severity, but blood transfusions to replace red blood cells and corticosteroids are often needed. Kidney damage may require extra medication to lower blood pressure. In extreme cases, kidney transplants may be needed. The most common cause of HUS is infection by certain strains of E. coli bacteria. Other causes can range from other infections such as HIV to the flu, or medications such as anti-rejection medications for organ transplants. HUS is most common in children under 5 and people with weakened immune systems. Next, we have Goodpasture syndrome, which is an uncommon autoimmune disease that affects both the kidney and the lungs. An autoimmune illness is a condition where the immune system, which normally defends the body against pathogens and infection, unintentionally targets healthy body tissues. Antibodies are proteins that the body's immune system makes to help fight infections. But in the case of Goodpasture syndrome, the body produces antibodies that target and harm the kidney and lung interiors. Symptoms of this illness include feeling weak, tiredness, and losing appetite. However, this illness can advance swiftly, causing you to cough up blood or to bleed from the lungs. People who are over 60 or between the ages of 20 and 30 are more likely to experience this issue. It's more common in men and Caucasians and it's not communicative. Next, we have maple syrup urine disease, which is a genetic illness where the body fails to correctly metabolize specific amino acids, which are the building blocks of proteins. The urine has a smell that is particularly sweet. That's why it's known as maple syrup urine disease, and it's found in kids. It's marked by delayed development, irregular movements, lethargy, poor eating, and vomiting. Maple syrup urine illness can cause unconsciousness, convulsions, and even death if left untreated. The DBT, BCK-DHV, and BCK-DHA genes can all be mutated to cause maple syrup urine disease. The instructions for assembling proteins that function as a complex are provided by these three genes. The amino acids leucine, isoleucine, and valine are found in a variety of meats, especially foods high in protein, like milk, meat, and eggs. The chemical makeup of these amino acids are seen below, and the protein complex is necessary for these amino acids to be broken down. And next we have Schnitzler syndrome, which is an uncommon condition marked by high blood levels of a specific protein, which is monoclonal IgM gammopathy, and a chronic reddish-purple rash, urticaria, that resembles hives. Symptoms associated with Schnitzler syndrome may include repeated bouts of fever, joint inflammation, joint pain, bone pain, and other findings such as enlarged lymph nodes. It's challenging to categorize Schnitzler syndrome, and some researchers have proposed that it's an acquired autoinflammatory illness. All right, so I know this presentation was kind of short, but it's also to give time to ask any questions. So if anyone has any questions about these diseases or rare diseases in general.
Yeah, I can get us started. This is a wonderful presentation. Thank you for highlighting the different diseases, Trisha. I think it's very important to talk about diseases that might not be very common, but are very rare and also affect quite a lot of people when combined, you know? Um, I think we can see that a lot of these diseases are caused by a recessive gene that must be present in both parents in order for it to be passed down to an offspring. Um, I know for cystic fibrosis, there's a lot of research going on in that to kind of look for ways to treat that disease, and it's also very expensive to find treatments for these diseases because they're so rare. Um, and so for cystic fibrosis in general, there's an enzyme called DNase I, and it's used to cleave, to basically cut um, different molecules. And so when you cut the mucus, then it kind of helps dissipate it. And that kind of helps treat people with cystic fibrosis. But it's also super expensive. And so people are working to like make kind of free use versions of the enzyme. And so that's super interesting. And yeah, so I think it kind of ties to genetics, which is a very interesting field if anyone's interested in that. Um, but yeah, I feel like these were super interesting diseases that you brought up, especially with the copper and the way you can see it in the eye with the slit lamp. Um, yeah, thank you for sharing that, and this presentation is wonderful.
Yeah, so I do have to say something about the Orphan Drug Act, which I mentioned in the beginning. It's actually an act to facilitate development of orphan drugs. So you have an incentive to treat them, which changed the way that pharmaceutical companies thought of treating these diseases, which I think is pretty fascinating.
Yeah, it's definitely very important. And then there are also I think you mentioned there are like different definitions. And is EU, does that stand for the European Union?
Yeah.
Yeah, so it's like in different continents and different places, there are different ways of classifying the diseases. But anywhere, like people who are affected anywhere, should be able to get that care. And I think the Orphan Care Act is super important.
Yeah.
Which one was your favorite to look into and research?
My favorite to look into was Wilson's disease, particularly because I find diseases where there's a buildup of unusual things in the body to really fascinating.
Yeah, I definitely think this is very interesting. Thank you for adding the image too. It really shows like what the effects are. Um, and I know
Yeah.
like in many of the diseases that you mentioned, there aren't really any like standard treatments or like what people would consider like standard of care. Um, and so it's very important to research these rare diseases um in order to kind of find a treatment for it. Because even though like not as many people are affected by it, like it still affects like their life. And I think it's also important to like look into a treatment for that. And I feel like for a lot of rare medical diseases, people don't really know about it unless someone close to them is affected by it. And so it is super important to advance research in these diseases as well. What was your inspiration for choosing these diseases?
Well, genetics interests me a lot, and a lot of rare diseases are genetic. That's mostly the ones that I chose to put in here because there are also other rare diseases that are caused by pathogens, but that definition changes wherever you are in the world.
Mhm.
Like in the US, malaria is not that common, but in other parts of the world, it's endemic, so it's always present.
Mhm. Yeah, it's super interesting. I'm sure a lot of you have heard about like genetics in your biology classes in high school. So like the Punnett squares and stuff. But these rare medical diseases are really like a actual real life like application of that, and how it can affect people and patients for and then also I think you mentioned that some diseases are communicative and those are basically spread, those can be spread, and non-communicative diseases cannot be spread through like contact. So non-communicative diseases are like cancer and like um heart attacks, like strokes and that. And communicative diseases could be like COVID, malaria, like SARS. And basically there's like research being done and it just shows that like in wealthier countries like the US, the more common diseases are non-communicative diseases, and in um, third world countries and countries that might not be as wealthy, the main types of diseases there that are more common are actually communicative diseases. So that's like a health disparity that's present um, in the world, and so that's also a very important concept to discuss.
Definitely.
Mhm.
And also, all these genetic diseases, they're trying to pinpoint where the genes are, and with new new developments in genetic research, there's there's a few that have been up and coming where you either alter the cells or you alter the like the baseline of all cells, the stem cells.
Yeah.
So there's a lot of research going into that, and research that goes into genetics also can further help these diseases. And usually there's a dichotomy of like, there's like medical research and then there's like actually dealing with patients. And I think that genetic rare diseases kind of ties it all together, where it requires doctors to have more knowledge of genetics and knowing how to treat these things.
Mhm. Yeah, and I feel like in California in the Bay, it's like a very big place with a lot of pharmaceutical companies, AstraZeneca, Genentech, um, and then they also do like a lot of work in that. So if anybody's interested in that, that's also a field that you can explore. Um, and I know next week we're having a session on medical specialties, but there are also some doctors who are kind of genetic doctors. So like if two parents have like they carry a gene for a rare medical disease or something, the doctor can kind of um, study that genome and kind of give them like advice on like whether they should have that child, and what steps to take to help the child when they're born. And so that's also a field that you can go into if you're interested. Does anyone know how many chromosomes the human genome has? Twenty-three pairs, yes, 23 pairs or 46. And so different mutations can happen on different chromosomes. And that's also a very widely studied kind of topic, like Trisha was mentioning. And so different mutations on different chromosomes can lead to different diseases, whether they be rare or common. And a lot of that is kind of used to diagnose disease, and some are like characteristic to different types of diseases. And so it's very interesting. And then your last pair of chromosomes is like the XX and the XY chromosome, and like that determines like your gender. And a lot of um, like males are more like likely to be colorblind because they don't have that extra X chromosome. And so you do learn that in your basic bio classes, and it does carry on into college and when you're studying for like different exams and stuff. So it's very important to to remember that and kind of see those concepts be applied as we do with this presentation here.
Also, if anyone is interested in learning more about rare diseases, Youth and Pre-Med also runs like a journal site, and there's some articles about rare diseases that you can check out.
Yeah, Trisha, you wrote one. It was amazing about like a rare medical disease. Did you want to talk about that?
Actually, the one that I wrote about, it's not that rare of a disease,
Okay.
but there are other pretty fascinating diseases on the website. Like I know there's one on EDS, there's a few on other rare diseases, and in the future, I'll probably end up writing more about rare diseases. So,
Yeah, if anyone's interested in writing, it's super interesting. You look into a topic, you write about it, and then we put it on the website to share with other people who also might be interested in those diseases. And in the past, people have written articles about different medical specialties, like health and wellness, kind of the medical pathway, and different medical schools, and like their goals and what they focus on. So it's very interesting to check that out. And if you're interested in contributing, feel free to reach out to us through email. Um, yeah, did you have any closing remarks, Trisha?
not really. It's
Okay.
kind of like to leave you guys with a little more knowledge about these rare diseases, as well as maybe an interest to look into it yourself.
Hmm. And this was perfect. And thank you for the discussion also. I think it's very important to talk about different applications of the stuff that we learn in class and also how these things all tie together. Um, so for the last slide, this is like our social media information. So we do have an Instagram, at Youth and Pre-Med. And then we have a new website through Wixsite, and feel free to reach out to us through email at youthandpremed@gmail.com. And then also, as Trisha mentioned, we have a journal, the Weekly Med, that you can look at. It's also on our website as well if you're interested. And so our next session will be next Sunday, um, and we'll be talking about medical specialties, and this will be run by a couple of our interns. So I'm going to stop the recording at this time.